In this session, we'd like to share with you how the Safe Places web tool and the COVID Safe Paths app can help contain the pandemic while staying committed to personal privacy. Using technology as an enabler, we can really make a difference if we collectively pitch in and change our behavior. We hope this information will encourage you to join this effort. Now let's take a closer look so you can understand how and why it works. The most important part of this whole thing is you. It's absolutely critical that we take some time to think about how we can change the course of the outbreak on the local scale and on the global scale. Eventually, we know we'll return to our everyday life. We'll still need to be hyper aware of our actions to help prevent further spread, but it's unlikely that every single one of us can accurately remember the full details of our days, much less a week or 2 weeks at a time, especially at a time when you're dealing with illness and all sorts of other stressors that are happening to so many of us. But knowing those details is exactly what it takes to track and contain the virus. So with new behaviors and new tools, we can put ourselves in a position to be safer now and in the future. So how do we stop the spread? The vision of Safe Paths and Safe Places is to basically balance the need to track the virus with a pledge to respect everyone's privacy. So let's talk about being a part of the solution. As a global community, we're facing the same challenges. Realistically, a solution is only possible if we can come together under a secure and effective process that everyone trusts. Safe Places and the COVID Safe Paths app were created through a collaboration of MIT, Harvard, and the Mayo Clinic. Healthcare workers use Safe Places to view, scrub, and publish anonymous location data about the virus. Contact tracers, that's workers who are identifying people that may have been exposed to a disease from an infected person using extensive interviewing and investigation. Contact tracers can access and anonymize data in the tool, giving public health administrators the data that they need to respond quickly to potential exposures. The Safe Paths app helps all of us. Undiagnosed people can get alerts that help them steer clear of potential hotspots. Patients get a faster, easier way to navigate their interview during what is already an incredibly frightening experience. And healthcare professionals get a tool that helps minimize the burden on their incredibly demanding roles, so they can work more effectively and efficiently to gather time-sensitive information and keep the public informed moment to moment as an outbreak is unfolding. The Safe Paths app and Safe Places web tool work together to create a really powerful way of tracking and tracing the spread of a virus that's a significant improvement on current methods. We know that contact tracing works to fight the spread of the virus, but we need a way to do it better, and we need a way to do it faster. So first, we can look at how contact tracing is done today. Using traditional methods, contact tracing is a long and difficult process. It's time-consuming and it's error-prone. Contact tracers basically have to reach out to people, find all of those people based on an individual person's memory, and interview them, which can lead to inaccurate and incomplete data. What Safe Paths does is take that vital process that's so important to stopping the spread and transform it into something that benefits the community and supports healthcare workers and delivers more reliable results. Using Safe Paths and Safe Places, contact tracing is faster, it's more accurate, and it's more organized. Individual members of the community can use the Safe Paths app. They can use that to check for outbreaks in their community and to share their location history if they're diagnosed. Healthcare workers can use the web app Safe Places to create redacted files during the patient interviews, and then local healthcare administrators can publish and respond to that aggregated and anonymized data that they get from the healthcare workers. Now let's look at Darren. Darren woke up feeling sick, and he's tested positive for the virus. He worries about who he came into contact with. His emotions are heightened, and it's making it really hard to remember the exact details of just where he's been and who he talked to. The app makes it much easier for him to share his data accurately with a single button click during his interview with the contact tracer. And Marisol. Marisol has been a contact tracer for the last month. She spends hours on the phone with diagnosed patients like Darren, retracing their steps. As you can imagine, people forget details and they have a lot of anxiety about reporting them accurately. With the Safe Places tool, Marisol can quickly look at the data, evaluate it, and use that to speak with Darren. She makes sure to redact or remove any personally identifiable or sensitive locations, which leaves just anonymous locations and timestamps. Equipped with reliable information, a 2 to 3 hour interview per patient minimizes to a much shorter period of time. It is absolutely critical to talk about privacy. Every single person should be concerned with how their personal information is being shared or used. Understanding how Safe Paths handles data is key to building trust and support for the technology. So let's get into it. When the app was created, privacy was the #1 priority. Technology can be used to expose private details and it can degrade public trust. Taking on a health crisis can't happen if people are uncomfortable participating. So with this in mind, the Safe Paths development team was committed to finding a better approach that focused on privacy, not just as a feature, but as the guiding principle of the design. Let's talk about that design. Your data is stored on your phone and not on a central server that could be controlled by any one state or federal source. By decentralizing the process, Safe Paths puts the user in control of their data. Each one of us owns our personal data. No service provider or agency should be able to use your data without your consent. That's why no one is required to share, and only people who are diagnosed with the virus are encouraged to submit their data. Once it is submitted, all personally identifiable information is removed from the file, it's anonymized, and it's never shared with third parties. Even with this level of security and privacy, you might be asking, why should I share? That's a great question. We all should be wary of how we're sharing our data and who we're sharing our data with. But we also know what kind of effect a pandemic can have on public health, on our communities, and on the resources that we all rely on. If we can consider new perspectives on sharing limited information during critical moments like these, it can be a really, really powerful way to help stop the spread and save lives. Safe Places is the redaction tool that contact tracers use to help keep a diagnosed patient's data anonymous. It's quick and it's simple. If you think about our example from before, Darren sends Marisol the file of his location history, which makes the interview faster, and she removes any sensitive locations and leaves just pins and timestamps. That anonymous data can then be aggregated into very powerful maps that can be used for analysis of the virus's path. The Safe Places web tool is designed to make interviews faster and more accurate because contact tracers can use that visual map of the patient's locations to guide the conversation, verify their travel, and then remove all personally identifiable information. That provides meaningful information that healthcare administrators can act on. As healthcare professionals, you can promote the Safe Paths app by helping to educate patients. You can let people know about the privacy components and try to help them see how their simple contribution can make such a huge impact. If possible, a quick demo of the Safe Paths app can really help to show patients the intuitive design and give them a sense of the functionality too. After the patient consents to sending their location in the Safe Paths app, the Safe Places redaction tool interface lets contact tracers validate that patient's location history within a set date range. So they can easily remove sensitive locations and they can flag if travel was done by car to create a more meaningful representation of that patient's location history. As healthcare workers, you are facing this unparalleled challenge as a part of your role. It'll take a collective effort to overcome, and it requires a solution that values our privacy alongside our health and our safety. COVID Safe Paths can provide an easy way to enhance a patient's experience and to improve your workflow at the same time. So by adopting these technologies, we can empower everyone to change our behaviors and help stop the spread.